Pioglitazone after ischemic stroke or transient ischemic attack. Definition: Ischemic stroke is usually caused by a blood clot that blocks or plugs a blood vessel in the brain. This keeps blood from flowing to the brain within minutes. Brain cells begin to die. Another cause is stenosis or narrowing of the artery. This can happen because of the atherosclerosis, a disease in which plaque builds up inside your arteries. Transient ischemic attack occur when the blood supply to the brain is interrupted briefly. Having a TIA can mean you are at risk for having a more serious stroke. Patients with ischemic stroke or transient ischemic attack (TIA) are at increased risk for future cardiovascular events. Despite current preventive therapies, the identification of insulin resistance as a risk factor for stroke or myocardial infarction raises the possibility that pioglitazone with improved insulin sensitivity might benefit patients with cerebrovascular disease.
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via two major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow. Immediate treatment for your stroke may help to minimize brain cell injury and death. If you have an ischemic stroke, you may be given medication to break up the clot causing your stroke. Later, your doctor may recommend surgery, such as carotid endarterectomy, to reduce your risk of having another ischemic stroke.
Applications in medicine. Treatment of insulin resistance represents a potential new preventive strategy that could be added to standard care after ischemic stroke or TIA. Insulin resistance is nearly universal in patients with type 2 diabetes, but is also present in more than 50% of patients with type 2 diabetes who have had an ischemic stroke or TIA. The presence of insulin resistance increases the risk of vascular disease, possibly because of associated hypertension, hyperglycemia, hyperinsulinemia, dyslipidemia, endothelial dysfunction, hypercoagulability, inflammation, and increasing platelet reactivity.
Pioglitazone improves insulin sensitivity and prevents ischemic stroke. Pioglitazone is an anti-diabetic drug which is used to control high blood sugar levels in type 2 diabetes patients. It helps to restore the body's proper response to insulin, thereby lowering the blood sugar. It reduces the risk of stroke in patients who had the history of ischemic stroke or transient ischemic stroke. The main objective of the study was to improve the insulin sensitivity in the patients who had the history of ischemic stroke and also to lower the risk of diabetes. The sample size of 3,876 patients was selected for the study. The homeostasis model assessment of insulin resistance (HOMA-IR) index was used to measure the insulin resistance in the patients. Around 3,876 patients who had the history of ischemic stroke was selected for the study. The candidates who were eligible for the study did not have diabetes but were insulin resistant. The patients who were recently diagnosed with bladder cancer and women who were pregnant or breastfeeding were excluded from the study. The graph was plotted between the patients who received pioglitazone and placebo. It showed that there was a decrease in the risk of ischemic stroke in patients treated with pioglitazone compared to patients treated with placebo. There was a decrease in the risk of developing diabetes in patients treated with pioglitazone compared to patients treated with placebo. The study proved that the patients who received pioglitazone had lower risk of ischemic stroke or myocardial infarction than compared to patients who received placebo.
Clinical strategies to improve insulin sensitivity included exercise, diet, weight reduction, and medications. The thiazolidinedione class of peroxisome proliferator activate receptor agonists are among the most potent insulin sensitizing drugs available. One medication in this class, pioglitazone, may reduce the risk of cardiovascular events, including stroke in patients with type 2 diabetes, for whom the drug is currently approved as a glucose lowering agent. We designed the insulin-resistant intervention after stroke trial to test the hypothesis that pioglitazone will reduce the rate of stroke and myocardial infarction after ischemic stroke or TIA in patients with acute diabetes who have insulin resistance. Pros.
Good afternoon and welcome. I'm Bruce Ofiagale, Vice Chair of the ISC Program Committee. I'm here with Dr. Walter Kernan, Professor of Medicine at Yale University and PI of the IRIS trial. Welcome, Walter.
Thank you, Bruce.
So we'll jump right into it. Walter, why did you and your colleagues do this trial?
Well, there were years, even decades of research before we started showing an association between insulin resistance and risk for stroke and myocardial infarction. Then in the 1990s, along came a potent anti-diabetes drug which ameliorated insulin resistance. So we asked the question, if we use that drug in insulin-resistant stroke patients, could we keep them healthier?
Great. And so what was the design of the study?
It was a multi-center, randomized, placebo-controlled clinical trial.
Okay. And what did you find?
Well, we found that pioglitazone effectively prevented recurrent stroke and myocardial infarction among patients with a recent ischemic stroke or TIA who were not diabetic but had insulin resistance. It reduced the risk of recurrent stroke and myocardial infarction by about 24%.
What do you think the implications are for clinical practice?
Well, I think there are a few implications. One is that the results of our trials suggest that pioglitazone is likely to be an option for patients who've had an ischemic stroke to help them prevent further strokes and myocardial infarction. Keep in mind the patients in our study were already receiving optimal medical care. They were getting their blood pressure controlled and so forth. However, we think it's going to take some time for the scientific community and the stroke community to consider our results and come to a consensus about how they should be brought into clinical practice.
Were there any unexpected findings or concerns that might have impact on clinical practice from the study?
There were no unexpected findings, except perhaps that we had very little heart failure in our study. In previous research on pioglitazone, the drug had been associated with an increased incidence of heart failure. We didn't find that. We think that's a result of us selecting patients who didn't have heart failure to begin with, and also managing patients according to a safety protocol. We did observe side effects that are reported with pioglitazone. Pioglitazone's been associated with bone fractures and with weight gain. We observed both of those side effects in our population.
Well, Walter, congratulations on bringing such a terrific study to completion and all the very impressive results. Thank you.
Thank you very much.
Thank you all.
Use of this drug helps find type 2 diabetes and also prevent ischemic attack. The drug has a double benefit for most people. The rates of death, myocardial infarction, or stroke were significantly lower with pioglitazone than with placebo. A favorable effect of pioglitazone on the progression of subclinical arteriosclerosis among patients with and those with acute diabetes. Cons.
This information is provided for public education purposes only and is not intended to substitute for a manufacturer's directions or consultation with a licensed pharmacist or healthcare professional. All medication, including those available over the counter, can be harmful if not used as directed, and taking more than one medication could result in harmful drug interactions. Please consult a licensed pharmacist or healthcare professional before taking any medication or changing an already approved or prescribed medication plan.
Hello, my name is Allie, and I'm a student pharmacist at the University of Arkansas for Medical Sciences. Today, I'm here to talk to you about your medication, Pioglitazone. Pioglitazone is also known as the brand name Actos. Pioglitazone comes as a tablet dosage form. Pioglitazone is most commonly used for the treatment of type 2 diabetes. Pioglitazone is usually taken by mouth once daily and is safe to take either with meals or on an empty stomach. Some common side effects with pioglitazone include swelling in the hands or feet, lightheadedness or shaking, runny nose, and sore throat. Some less common side effects with pioglitazone include headache, heart failure, and muscle and bone weakness. Do not take pioglitazone if you have heart failure or are allergic to pioglitazone. While taking pioglitazone, remember it is important to tell your doctor or pharmacist if you have signs of an allergic reaction, such as a rash, itching, swelling, or tightness of the chest, change in your vision or blurred vision, if you have blood in your urine, pain when you urinate, increase in the amount of urine produced, or pain in your lower back. Pioglitazone may weaken your bones, so discuss a way to keep them strong with your doctor or pharmacist. It's also important to tell your doctor or pharmacist if you start taking new medications, vitamins, or supplements. Thank you for watching, and if you have any further questions, please contact your pharmacist or healthcare provider.
We observed previously recognized adverse effects of pioglitazone on weight gain, edema, and bone fracture. The drops has no overall effect and cannot have an effect. Issued applied in Ecuador. We determined that enrollment of 3,136 patients will provide a power of 19% to detect a 4 years cumulative rate of stroke or myocardial infarction that was 24% lower in the pioglitazone groups than in placebo groups, assuming a two-side type 1 error of 0.05 and a 27% outcome rate in the placebo group. For interim analysis of the primary outcome were conducted for efficacy and futility with the use of the O'Brien-Fleming method. 19 The second and third interim analysis, the Data and Safety Monitoring Board recommended an extension of recruitment and follow-up owing to slower recruitment and a lower overall event rate than anticipated in order to maintain the statistical power. Decisions were made in closed sessions, and investigators were not aware of event rate during the trial. Conclusions. think that in this trial involving patients with type 2 diabetes who had insulin resistance, along with a recent history of ischemic stroke or TIA, the risk of stroke or myocardial infarction was lower among patients who received pioglitazone than among those who received placebo. Pioglitazone was associated with a lower risk of diabetes but with higher risk of weight gain, edema, and fracture.